It's Dr. Chris Balt here, Long Neck Chiropractic. Thanks for checking out our website this week. You know, I wanted to talk to you about an increasing epidemic that's occurring in the United States. And I know we're going to take a break today from discussing a lot of the problems with the pain medication, the opioid addiction issues. We're going to deal with something that might hit more at home. That's going to be the consequences of things like texting and driving. You know, I've been in practice for 30 years. And one of the major things that we do see in our office are people who've been involved in accidents, whether it's on the job or a car accident. Most recently, we've been seeing a lot of people who've been involved in accidents that were stemming from where one or both of the people were not paying attention. Years ago, it seemed to be most accidents were just either truly accidents or they had some sort of substance abuse problem, alcohol or drug use. But now it's very, very common to see very serious impact accidents due to texting and driving. I remember when I was 16, which has been quite a few years ago, I had to take a test for motor vehicles. And at that time, I remember the statement says that a car that's traveling 50 miles an hour is traveling more than 60 feet per second. So when a person glances down at their phone to either check a message or even to make a phone call, for every second that their eyes are off the road, your car is traveling 60 feet. With the average text taking somewhere between 15 and 18 seconds to complete, it's not unreasonable to think the car could have traveled somewhere between 800 and 1,000 feet. So what we're looking at is somewhere between 2 and 3 football fields. And so with the heavy traffic as we see in Sussex County, and the roads that are that have drop-offs, little or no shoulders, these kinds of accidents occur on a frequency that makes me scared. I've seen a number of my patients who've been involved in accidents here on Long Neck Road where someone pulled out in front of them because they failed to see the stop sign at a intersection that they've been to for years. I've seen a number on my journeys to Georgetown where someone was slowed for traffic and the person behind them ran into them at the posted speed, 50, 60 miles an hour, never even saw the car ahead of them. What happens to the injured people is when they're unprepared for an accident, the initial impact of the accident forces their spine into what we will call a whiplash type position. And obviously that's straining the ligaments, the discs, the muscles, and the tendons that support the spine. What we don't recognize often is cradled within our cranial vault, our skull, is our delicate brain. And as the head gets whipped forward and backward, the brain can slide and hit the front part of the skull and the back part of the skull. Sometimes not to an extent that it can actually be seen on a CAT scan or MRI in the hospital, but often to the extent that it begins to cause issues with memory, balance, even moods, personalities, and things like that change. And I'm seeing way too much of these issues. So I'm going to ask you guys as your healthcare provider and as a member of the community that you have to put your phones down. Put them on silent, put them on vibrate until you get to the destination which you need to do. You know, if you do know somebody who's been involved in an accident, you know, feel free to have them come in. We'll take a look at them and work them up and we'll treat them appropriately. And so what I'd like to do at this point now is I'd like to just shift gears just a little bit. You know, I did mention that we do treat folks who are involved in auto accidents. I'm one of the few chiropractors in the state of Delaware that's certified by the State Board and the Industrial Board to testify on a person's injury as well as their permanency of their damage. So if you do have people who've been staggering around with problems that have been unresolved for days, weeks, and months, send them in. We can take a look. We can work them up. We can make sure that they get the care that they need and document their injuries for their future. So I'm looking forward to seeing you guys. If you have any personal questions, feel free to call the office, and you know the number, 945-4575. My email address is on the website. We'd love to see you. We'd love to hear from you. And I look forward to treating you soon. Thank you.